headache. Actually, it might even be a migraine tonight for President Obama. 21 out of the nation's 29 Republican governors fired off a letter with a new plan of attack to derail the health care legislation. Now, the letter got dropped on Health and Human Services Secretary Kathleen Sebelius, but the 21 Republican governors are not just complaining about the health care law. They are demanding some very specific changes. Nebraska Governor Dave Heineman joins us live. Good evening, sir.
Good evening, Greta.
I know you don't like this health care law, sir, so tell me, in this letter that you have fired off to the Secretary Sebelius, what is it that you are asking her for?
Well, Greta, let me reiterate, you're right. We don't like the health care law. We're going to try to fight it in the courts, and hopefully we can win there. But short of that, as governors, we have a responsibility to implement it. So specifically in this letter, we talk about these insurance exchanges. We want greater flexibility. Who's going to be in it? Who isn't? Who's going to pay for it? And most assuredly, we're concerned about the plan design. We want greater flexibility in how those insurance plans could be drafted rather than a federal dictate.
Have you actually seen the plans? I mean, I've looked at this federal health care law. It's quite daunting. It's about 2,700 pages, and it's been shipped out for all sorts of rules and regulations to be added to explain it. But have you seen what the federal government wants to do about exchanges?
They have not provided us the rules and regulations yet, specifically on that plan design. And again, people need choices. We'd rather see it operate like a free market system, and that's what we're concerned about. Can the Secretary exercise a great deal of flexibility? I'm very concerned that won't happen, but I hope it does.
Now, in terms of if Secretary Sebelius did what you want, and the 21 governors who've signed onto this letter, would that satisfy you that the health care law may not be ideal in your mind, but would you then at least be satisfied that the health care law was something that could work in your state and would be good for your citizens?
Well, we'd still fight it. And in fact, you know, 4 Democrat United States senators have already said in recent days it's imperfect and they want to change it. My question for them is, why did they vote for it in the first place? So, no, this is about implementation, but we'd prefer not to have it at all. The other thing that really concerns me, Greta, and you know this from history with the federal government, they've greatly underestimated the cost and greatly overestimated the savings in this bill.
Well, the thing that's sort of curious, I mean, a couple things. One is that you have this mandate that is one of the primary ways that this bill is going to be funded. That has been thrown out in Virginia. It's been thrown out in federal court in Virginia. It's been thrown out in federal court in Florida. If that holds up in the United States Supreme Court, and I don't know which way the Supreme Court's going to rule, but if it does, that it's out, then you've got a funding problem there. Then you've got the problem with some states complaining that the Medicaid expansion is going to be rather painful financially to the states. All you states are in trouble anyway. And now you tell me these insurance exchanges, you don't know what the cost is because you haven't seen what the rules and regulations are, that you don't even know what you're facing. Is that a fair statement?
Well, that's right, Greta, and we're very, very concerned. It's why I've suggested, for example, why don't we suspend this federal health care law for 2 years to let it work its way through the court, and then we'll know with certainty how the United States Supreme Court is going to rule. Secondly, in the meantime, they could figure out how to make this a better bill. I mean, we all know the health care system can be made better, but this bill didn't do it. It didn't really address the cost of medical care, the cost of skyrocketing premiums.
Yeah, I don't recall which state is in the Florida. Is Nebraska in the Florida litigation?
Yes, we're part of that. Okay. We've been part of it from the beginning.
All right, here's an idea. Instead of asking that the federal government suspend the health care legislation for 2 years, and a lot of it doesn't go into effect until 2014 anyway, why don't you ask your Attorney General, and why don't you join him or her to go to President Obama and say, would you please instruct the Justice Department or ask the Justice Department to join us in going right to the Supreme Court now, because this could be decided in 60 days. Then you wouldn't need to suspend it for 2 years, and you'd know in 60 days, because I guess this really isn't a complicated legal issue. It's just a matter of the Supreme Court deciding it. Why don't you do that? Why don't you push for a fast track?
Well, Greta, we're going to do that. I've listened to you the last week or so, and I'm in full agreement with you. Let's get this thing decided. You are likely to see a letter, certainly from a number of governors in the coming days, asking the Obama administration to do that. Certainly our Attorney General, John Bruning, and I definitely support this fast track. Let's get it decided. And I'm with you, even though I'm not a lawyer, that this could be decided in the next 60 to 90 days.
And I'm very flattered you've been watching, Governor. Immensely flattered. Thank you, sir. And thank you for joining us.
Thank you.